Good evening, everyone. Thank you so much for joining us tonight. Welcome to our webinar on Reclaim Your Shape, How Sofwave and Pure Impact Treatments Lift, Tone, and Define After Weight Loss. Tonight's webinar is sponsored by Sofwave. Before we get started, I'd like to share that questions will be addressed at the end of the webinar, not during. If you have any questions, please use the Q&A icon located in the Zoom toolbar. That's, for most of you, it may be at the bottom of your screen. Today, we're honored to have our speaker, Dr. Johnny Franco, who I've been talking about. He's got his University of Texas jacket on there tonight, so if there's any UT fans out there. And our moderator, Dr. DiBernardo. Get ready to learn from the best in the field. Thank you for joining us. So let's begin.
Okay, thank you very much, and welcome everybody. Welcome, Johnny. Thank you so much for doing this. And let's go to the next slide. We're going to hear about some really cool devices, and I'll start to give us a little history here, and then you'll see what's going to transpire in this exciting webinar. So we've had a long history of energy devices and plastic surgery. And we were there from the beginning. I don't know if you were, Johnny. He's too young. But we started in the 1990s with fully ablative devices. The first one was a coherent ultrapulse in the 1990s. And these devices were highly efficacious, but there were big downsides also. You really made big differences, but there was a long recovery from them. And they would run kind of hot, and but it was a start, and it was a very good start. Everyone was very excited about it. Then as we went into the next decade, then it turned around, and it was like the completely non-ablative era. Everyone got shell-shocked from all that downtime, and it's like, now we're going to have no downtime. But the problem there was, with no downtime, there was almost not much efficacy also, so it came around 360. So that wasn't good either. And then in the next decade, I think everyone learned and said, we got to get some kind of results. So that's where you saw the fractional ablative devices, the non-ablative devices. So we had some improvement and some downtime also. And that takes us to our current decade, where now we're returning to non-ablative and no downtime, but we're getting results. So, we learn every 10 years, and we keep improving, fortunately. Next.
Barry, and this is I think is super helpful, because as people may or may not know, when I have a question about laser, I text you and Jason to ask about it, because it can be challenging for people. I mean, the last thing people want, and when I was a fellow in Miami, they had something they called the $1 million closet, which was a closet versus all the devices and stuff they've bought that adds up to $1 million that you can't use. And so I think definitely just a point. If you have questions about how this fits into their practice, put them, because Barry's not giving himself enough credit. He is a laser expert, and really will be upfront about pros and cons of this, and kind of where Sofwave really fits in. So use him as a resource.
And Johnny, it's kind of like, I think Jason has $1 million garage too, but it's like he's got cars in there like Ferraris, and they do really well, but you need to know how to drive them the right way, like the lasers. And I think what we've done over the years is we've taken these devices and make them easier to use, just like cameras. When I started in the 70s, it was all manual, and now you can take really good pictures with your iPhone, because it's just gotten that much better. And I think that's what we're seeing in the devices also. Then we have market dynamics, and this is information from ASDS. So look at procedures that people are considering today. They're looking at laser hair removal. That's still number one. That's been there for years. But then 53%, the next highest category, is laser or energy-based devices for skin tightening and wrinkles. Then we go to body sculpting. That's the next biggest one. You've got your injections, and then other lasers for skin tone and redness. But the important thing here, and something I talk about a lot, is whatever we do, what's the most important thing? Like, you can have a patient who's getting older in their 50s, maybe 60s, and you could do the best body contouring and remove the fat. But if you don't have a tightening device, if you remove fat and there's saggy skin there, they don't look good. So I've always believed that tightening skin is the holy grail here. So my market dynamics, the US is the country with the most non-surgical procedures, over 4 million. Non-surgical skin tightening is up over 13% since 2002. So I think the theme here is skin tightening's really important, and the better ways we get to do it with the least downtime is something everybody's interested in.
And Barry, don't you think that those numbers are probably lagging and are going to continue to explode over the next 5 to 10 years with all the weight loss drugs? And you and I had talked a couple of weeks ago about, I mean, even seeing such young patients with skin laxity. It used to be something that we were thinking more of our mature patients and so forth. And, I've picked your brain a couple times about what do you do with these 20, 30-year-olds with skin laxity? I have a hard time offering them, even as a surgeon, a facelift or something else. And so, I think it's really challenging. And the nice thing is you're going to get these really young patients in your office with skin issues that, if you take care of them in the right way, they're going to be your patients instead of for 15, 20 years. They could be your patients for 30, 40, 50 years.
Oh, absolutely. And I think it's just going to be growing exponentially. So it's really important. Let's see the next slide. So we saw the rise of microneedling. Patients are receiving 30,000 needle insertions with little to no lifting or volumizing. I think, I think there's probably something like 54 microneedling devices out there. Primary results show more of a resurfacing effect. You're putting needles into the skin. If you go too deep, now you're in the fat layer. You can risk fat loss in areas that people don't want fat loss. They're putting in fillers. And all the devices are used off-label because there are zero lifting clearances. And you can see year to year, these have been really growing in popularity. And frankly, when you talk to patients and describe it, I don't think they are really enamored with having a bunch of needles going into their face. So this is like the microneedling era as well, or it had been. Let's go to the next slide. This is looking at the history of non-ablative skin tightening, at least theoretically, as we saw before. Originally, it was the CO2 lasers, the erbium YAG lasers were there, and these were fully ablative in the first 100 microns. Then we went to monopolar RF, like our thermies and things like that. So we're getting tightening. We went to focused ultrasound in 2005, and that device was called Althera. But problems there was it really hurt a lot. It cost a lot to run, and the procedure with all the changing of levels would take like an hour and a half. So the good thing was this was the introduction of ultrasound. It was good we could see the levels, but there were a lot of problems with that too. Then we're talking about the temperature controlled needle radiofrequency, and that gained in popularity. And so you see that the bulk of the providers and the bulk of the patients are moving in a direction, but they're in search of the holy grail here. And that takes us to current, where we now see in 2019 parallel beam non-focused high frequency ultrasound. That's the Sofwave device. And it had many, many improvements that we saw from the HIFU going backwards. And we'll talk about it, the cooling, the proper depth in the dermis. But now we took iPhone 3 and became iPhone 16. And that's where we are today. And that's what we're going to be talking about today.
And we're not bashing any of these products. We've had a lot of these, and they were the best of technology that was available at that time. But, things just keep progressing.
And right, like if it was 1940, 1950, did you not use a car because it wasn't the car we know today? No, it's what you had at the time. It seemed really good. And I think I'll end with this one, which is comparing the older ultrasound technology, where we saw these little blips in the skin. We were all enamored because we could see those little dots. We can control changing very expensive transducers to get different levels with them, to and discomfort over there, to what we're seeing on the right, which is the Sofwave, where now we have these cylindrical areas of treatment, huge area by volume that we're treating, and we're treating it right 1.5 millimeters down in the middle of the dermis, is right where we want to build collagen and elastin. So we're getting 2 times the volume you saw per line with the other technology, and this is now taking us into what we're going to talk about first, which is the Sofwave. So take it from there, Johnny.
Yeah, I think this is, and again, I don't want to get lost into the weeds of numbers here, but I'll tell you, as a practice that have sort of like Barry have had a multiple different devices over the course of our history, and we definitely had the HIFU back in the past. We've actually had it at where I did my fellowship, and then at our practice, and I think it was great at the time step. But a couple of things that Barry had echoed. I'll echo some of the things that he said in terms of the amount of time the treatments took. I think at this day and age, I think we keep getting held to a higher standard of results and treatment stuff. And I think we'll show you some things that hopefully the pictures speak for themselves. Some are our pictures, some are that of our colleagues. And so I think this is just a mathematical, if that's your thing, in terms of how that energy is distributed. What's super interesting, I think some of the things that Sofwave has really advanced forward, and I know they got some more stuff in the near future stuff, it is, the ability to really put a good amount of energy at a very precise spot. And especially when we're talking about treating people who are going to need treatments over the course of their time, is that we're not affecting the really deep structures. If you're a surgeon, that's going to affect your deep plane facelifts or other things, but we're getting you into a good spot that you're going to see a meaningful difference. Because I do think that the wellness wallet is a thing, and I think people are willing to spend money, but something that you truly believe in, that's going to make a difference. And so we've been super excited with Sofwave in our practice here. This is some of it, and I think Barry talked about this a little bit, but this picture is kind of interesting just to compare some of these. And this is honestly something that we use in our office and definitely should use more. I think sometimes patients get confused about all the different devices out there and what's unique about them, because, if anybody's kind of heard this statement from Gary Vee about the TikTokification of marketing, and sometimes there's so much noise, so much stuff out there, it's confusing for patients. And when they get overwhelmed and they're confused, they don't make the decisions. And I think, the same things happens for providers. We hear this, you can see where, these have different depths, and we're doing an RF microneedling today stuff for some skin textures. But, again, you have to worry about, where's that energy being applied? What's, if it's Patrick, are they, what's the level of this, and things that, us as providers, or if you're a practice owner, you worry about. None of us want problems. We just want patients to be happy.
Yeah, and as you said, the doctors, the providers, they're confused also. And
yeah,
these are all expensive devices, and it's not like you can get one and, okay, I don't like it, I'm going to change. They're very costly. So it's very important to, find the one that's really right, make the right decision. And also, it's as you were saying, the others have a lot of decision making. What depth am I going? How many milliseconds, millijoules? There's a lot of decisions to be made. Whereas in something like Sofwave, it's easy. It's easy. It does one thing. You're going to get consistency, and that's also the thing going forward. It's got to get results, but it's got to be simple. And what are the 3 things patients and doctors look for? It's comfortable. It's not going to hurt me. I'm going to see results. It's reasonable to operate from a cost standpoint. Those are all important things, because if you hurt someone, they're not coming back to you. They're not going to do that treatment again.
And that's stuff that you and I, as the provider or surgeon over, maybe if you have some extenders underneath you. I mean, that's the stuff that makes us lose sleep over. We got in this to help people, and especially from an elective procedure stuff. And then you mentioned cost. The last thing is opportunity cost, because it's your reputation on the line. If you bring something in, if you're saying that this works, I feel strongly. I mean, I know Barry feels pressure when I ask him a question on a laser and Sofwave particularly. I asked him what he thought before I pulled the trigger, because we had multiple offices and it meant multiple devices, and I put him on the spot and he went to the mat. So I felt strong about it.
And the patients, at least, patients know our practice, and they know I research these things 7 days a week, day and night. And if we have something there, they know I really shook the trees on it, and that's like the next best thing. So you gotta trust the message, and that's what we work on.
Hey, Barry, I think this is one of the things that is again, not to get lost in the actual weeds of the numbers here, but more the overall picture that, there's a lot of devices out there that make statements or claims about what they do. You'd be surprised when you actually ask for true clinical studies, how few of them have this many FDA clearances, clinical studies, different things in terms of this. And we'll get into, we haven't even gotten to Pure Impact, but getting to actually meet some of the team behind, Sofwave and Pure Impact, and how passionate they are and the thought they put into this, that we'll get into in a minute, some of the things that I'm personally super passionate about. I think it's just really speaks to them overall as a company, just in terms of the amount of clearances and FDA stuff that they've really gotten in and put time into.
This is the part I'm proud of them for, because a lot do studies. It's not that, but they have not just doing a study to do a study. They get the clearances on all these and look at the list: facial lines and wrinkles, of course, lifting the eyebrow, submental laxity, lax neck tissue, the cellulite, acne scars, and that's not the end of the list, because we're working on other ones now. We're doing a lip lift study, so they're hammering out these clearances, and it's nice to use a machine that has clearances, not like you can wing it and try this and try that, and it's not approved for that.
And everybody's got a little bit different practice, but I think eyebrow, submental, this is interesting. Eyes, I always think, is a hidden gem, honestly. The eyes, the brow stuff, because that's one of those where, people say you look better, you look refreshed. I think that is just a underutilized treatment area in facial rejuvenation. And I think with some of the weight loss stuff, you're going to see a lot of this submental. You're going to see some of this laxity in the face with, this very mild to moderate. I'll tell you our own personal experiences. And the old saying is that the people that need it the least benefit the most. And what's been interesting is treating this very unique young population of these weight loss patients. So treating 20, 30-year-olds with skin laxity. For anybody who's not familiar with my own personal story, I've lost about 90 pounds over the last 2 years, and I'm going to still put myself in the younger category, maybe not the young category.
You're wasting away, Johnny.
But I was super responsive to the energy devices and Sofwave and Pure Impact. And I think when we're, at a little bit younger age, I mean, we all know that we lose collagen, and our skin thins as we age. And so I think that's why you're going to see some really, really amazing results with some of our younger patients that are going through some of this.
So just back up for 1 second.
Oh, sure.
The brow is an important region, because I see a lot of patients who do their upper eyelids. We do that, no problem. Some of them have brow ptosis, and they have no problem doing eyelid surgery. When I start getting into brow, you'd be surprised how many just don't want to do a brow lift. Now you're telling me too much. Now it's too involved. So to have a tool like this, which can get that brow lifting non-invasively, is a really good aspect and a very good clearance.
Mm-hmm. Arms has been one of their more recent ones. It's been absolutely fabulous. My mom actually had this done probably about 6 weeks ago for her arm. So her pictures are in progress, and hopefully we'll be on one of the next webinar stuff. But it's an area that surgically, there's not a ton of great options for this unless you're just a massive weight loss and you just have these just tremendous amount of skin. And so I think being able to give somebody some options without a big scar down the back of your arms, I think is absolutely priceless. I think we're just going to continue to see more and more of this.
And from the weight loss standpoint, don't patients come in, they're 100% focused on, I want to lose my fat, I want to lose my fat. And they don't even think about, hey, I'm going to have a skin problem there, right? They don't even think about that part.
They don't typically until they're about 6 months into the journey. And then once they start getting compliments, they start feeling good, then it starts to do something. And then people start to bring about it. But I also think this is where there's an opportunity for us to educate people about options, because if you really look at it, there's these aesthetic naive group that we're going to see more and more of, because if you look at half the patients that come into aesthetic practices for weight loss are new to the aesthetic industry. So you get this whole group of aesthetic naive patients, and Barry touched on this on the last slide. It's much harder to convince somebody who's new to the aesthetic industry to get a surgery that's going to leave a scar down the entire back of their arm than it is to do something that's going to tighten this. And this is a little bit more extreme. We see a lot of patients that just have a little bit of laxity, especially in these 15 to 30 pound weight loss. Those are perfect candidates for this. But, if it's helping these patients, it's going to help, some of our less extreme.
And with this slide we're looking at, this is the arm study. And I have to commend Eric, Amy, Susie, and Roy on this one. But look at, this is non-invasive. You're getting, at 3 months, 93% of arms showed improvement. 93, the GAIS, Global Aesthetic Improvement Scale, that the patients score 93%. So that's some strong numbers on this study.
Oh, 100%. And then here's just some more pictures for Dr. Saltz, one of our dear friends. And so, I think that is a really significant change. And even when we talk about arm lifts, right down towards the elbow stuff becomes a very challenging on the front side or towards the end, because that's where a lot of our surgery starts to end.
Mm-hmm.
Again, not a surgery change, but I would still call this a huge win. And I think, it is important to be upfront with patients of what they're going to get. But, showing them stuff like this, I would say that this is a phenomenal result from a non-surgical treatment.
I think you have to learn how to look at these. Like this example on the left, this is a very hard thing to treat. And what you're actually seeing is, if you think in your mind, as you said, are you going to get a surgical result, meaning the lines are all gone? It's not, but we still see some lines. But what we are seeing, and you can really see it with your eyes, is that the skin host is thicker. It's built collagen. You can see that thicker skin rather than that tissue paper on the left.
Which is going to improve them, even if they ever decide down the road that they want surgery, they're going to do even better.
Mm-hmm. It's a prep.
Here's I think a closer look of one of the other ones we've seen, but you can really see, they did a nice job in the study of kind of really marking things out, measuring it to make it a little bit easier. And I think just a great example.
Yep.
Here's just another look of the picture we've seen earlier, but to Barry's point, just a phenomenal improvement for a treatment in only 4 weeks. So I really anticipate that this is going to continue to get better, because that's what we've seen in our patients. If you actually can get them coming in again, you even see more improvement. But usually they only come in when they're ready for their next treatment.
And one of the keys in discussing this with patients to get happy patients is, I just start off point blank and say, if you think, if you're doing their face, if you think this is a facelift, please don't do it. It's not a facelift. But if you want to get a degree of tightening, build collagen, make your skin younger, that's what you're looking for. You have to, they don't know what they're looking at. They don't know what the result's supposed to be. We have to orient them to the type treatment we're doing. But again, this is superb.
Just another good result. And gonna keep us moving a little bit so we can get to some other stuff here. This is really interesting, and honestly, this is a great picture by Virginia. But this is an area that I think is a hidden gem, and I'll tell you, in our practice, and I'm a lipo fat transfer BBL guy stuff. This is an area that we do half of our Sofwave treatments for is abdomen. And it's exactly this type of patient with a little bit of skin laxity right about above the belly button. They have just that little bit of wrinkling. They got a little bit of a frowny face. And especially with the weight loss stuff, this is what we see really, people who are at a young age, they've got overall pretty good skin, not a tummy tuck fascia, but they're actually, really fit. They've been working hard and they're in a great spot and they just want to see some improvement. So I think this is a great change. I think this is a hidden gem and a spot where honestly, surgically, there's not much I would offer this person. And so I think it really fits a void.
Mm-hmm. Right. Contour is good.
Contour is good. Back of the legs. This is interesting. I was giving a talk the other day about cellulite, and we all know the definition of cellulite and dimples being held, so forth. But a patient's definition of cellulite is anything they don't like in the back of their butt or legs. And so it's funny because they will come with cellulite complaints, but really a lot of times, especially like this on the back of the thighs, it's skin laxity. And when I do a lot of cellulite treatments and speaking for that stuff, and it's funny when people come to us with kind of patients that didn't improve, it was more of a skin laxity issue. In the back of these thighs, I think this is a great change for this, where again, there's not a lot of surgery that I would do to get this or make this change.
I think both the patients and most physicians don't really know the definition of cellulite, and I think they're skewed because there's been a history of companies that have made devices for the dimples only, and that's not cellulite. That is one of the three components of cellulite. When we did all the original studies on that in ASJ, it's raised fat, dimples, and skin laxity, as we documented in the ultrasounds. All these patients have a thinner dermis, and that's what leads the way to seeing the other defects. So unless you're going to treat all those components, you're not really treating cellulite per se. And I think the reason Sofwave is coming through here and got a clearance is because they're able to achieve one of those components, which is the skin laxity component, which just a dimple cutter can't do. So I think it's important to get a result like that.
And I'll tell you, a lot of our treatments of butt and legs are combination treatments, and they'll typically get skin tightening such as Sofwave, which is one of our absolute go-tos. One of the dimple cutters as well. So hopefully Barry doesn't get mad at me. And then sometimes biostim, because sometimes there's also a volume loss right now with all the skin laxity. So super interesting about how complex and honestly, I think we've seen more people addressing this because in the past, to Barry's point, there weren't a lot of good treatments or solutions for it. And so both providers and patients kind of shied away from it because they just felt like there was nothing to do.
And years ago, when there were, devices for the dimples like Selfina, where you had to buy, I don't know how much it cost, $60,000, $80,000. That was a problem. Now that we have a standalone like an Avali, it's $1,000. You can use it in conjunction with this. So you now have a good shot at getting even the most difficult of cellulite combinations.
But typically it does take a treatment, like Barry's saying, to really addressing all the things. And that can be a very good progress for the patient. So super interesting. Here's another phenomenal result in change, which I think back of the thighs, front of the thighs, I think those are areas that just, really, really bother people. And I think this has been phenomenal. And we've seen so much more of this.
You called it before, Johnny, that cellulite is anything they don't like. Look up there on the buttocks crease. You see a whole bunch of wrinkles. That's not cellulite, but they consider it part of the cellulite world. But look, They got better. They got better.
Mm-hmm. Pure impact. I'll tell you, this is one that's a little bit of a passion project to my own heart, and I think we were one of the first places in the country to have this, and was super interesting because as part of my journey when I kind of evolved into moving from trying to lose weight to just trying to be in an overall health, and you've seen a lot of the talk about GLPs and in muscle mass loss stuff, and something that we're going to talk about at the MAP meeting a little bit more in depth, Barry and I. But super interesting that now it's become such a forefront with this, and so no question that the rise of the skinny shot or the GLPs, has caused the skin laxity that we've talked about, but you've also seen some muscle loss. There's actually a couple of recent articles that actually came out that, really talking about some of this muscle loss, and she got the opportunity to meet with one of the obesity experts from Cornell recently, and was interesting to hear about some of this. Number one, not new to the weight loss world. We just have never seen it in this amount. I think, being proactive about it from a functional standpoint has been super interesting in terms of doing this. I think really as people are looking at, whether or not you have a, or weight loss is part of your practice or not. If you're not speaking to these patients, I think you're missing out. I'll let you guys, I know your time is super valuable, so I'll leave you in on a nugget here. The two most visited pages on our website, number one is Ozempic Face, number two is Ozempic Butt. Ozempic Face, when we launched it, had 250,000 impressions in the first 3 days that we launched that page. Just shows you how many people are searching for this. So, making sure that you're speaking to this, and that you have good solutions to do those things. I think you have such a unique opportunity right now. I think, it's a space that nobody truly owns. Most of us live in a space where there's a faceless expert, there's a liposuction expert. I don't think anybody owns the Ozempic Face or the rapid weight loss, skin laxity treatment stuff. So I think there's a real opportunity. I think there's real challenges. I think there's some unique solutions that we need to figure out. What do we do with these really young patients with, some muscle loss, some skin laxity, some targeted fat loss that needs to be treated? But I think there's a huge base that's being created that's going to continue to expand with some real needs. And I think experts that are on this, it's our kind of responsibility to help with that and find solutions for them. We've created something that we call the muscle mass movement, and it's just a way to really talk about this and integrate it with patients. And so again, we've really tried to become an entire program for patients. And so I think I'll get to it in a minute, but we actually have a treatment guide that we give patients, and that treatment guide really talks to them from the very beginning. Here's the changes that you're going to see. There's absolutely some phenomenal benefits, and if your provider thinks this is for you, great. But here, also know what, like everything in life, right? There's some trade-offs. Here's some things you're going to see. And no question, the more active you can be about talking about some of these muscle changes, talking about some things, and creating an entire program, I think the more successful you're going to be in this process. This is a Ozempic Face and body prevention and treatment plan that we created, and we just did this on Canva, and something super easy. It was to help our providers. It was to help the team really be super organized, and we actually give it to them at the first visit, at 3 months, when they reach their goal, and that way we can help guide them. Be like, hey, here's some of the changes you're going to see, just so you know. These are some of the treatments. I'll tell you, most of the people that are new to aesthetics will be like, no, I'm not here for that. That's not my thing. I'm not into that foo-foo stuff. But it's pretty amazing to see their transition over time of where they get to. And so little by little, you definitely see, a lot more of people being interested. But the hidden gem in this was how much it helped our overall office staff, because we were able to be much more organized in terms of this. They were able to understand what we were talking about. So even when they were taking phone calls, when they were handling leads, they were able to be like, yep, these are some of the things that we do in a very structured way. I'll tell you, cross conversion was key. In our practice, we're broken up into 3 pillars. We have surgery, med spa, wellness, and, just tracking how many conversions we had from wellness to surgery, wellness to med spa to surgery. Those numbers doubled in terms of the amount that we were doing, just because we were discussing it. And so, like most things, if you don't track it, it doesn't get better. If you don't track it, you're probably not doing as well as you hope or think that you want. But this was something.
A great chart. You gave us one of those. That's a great chart you made.
Oh, thank you. Mm-hmm. The history of biostimulants, this has been interesting, and I've had some of the first generation e-stems in our office, and some of these have exploded, and we'll get into really the fourth generation. What's been super interesting with this, and I think kudos to opening this new dimension in plastic surgery, and I think muscle was something that in the aesthetic world we really didn't focus on, and there was really limited answers for people, but super interesting. I won't deal too much on here because there's actually some great slides of what they've developed that's super unique to Pure Impact.
And this follows like what we saw before with the history of the lasers and all of that as well. You start with something, it gets you into the arena, but you're moving second generation, third generation, and yeah, when I saw this thing, it was like, oh boy, we've really come full circle here.
And that's exactly. So, I mean, and kudos to them, because when they first started, it was super innovative, and it was an idea, it was something that was new to the market, and like everything, it just keeps evolving and getting better and better and better. And even since we've had Pure Impact over the last, it's amazing how much they've updated the system to even be able to personalize it more and more and more for each patient. Having the treatments done pretty frequently myself, honestly, it's pretty amazing how sore and how much you feel some of this and how you can tweak it. They've gone from just trying to do this single muscle stimulation where you just try to stimulate a muscle to fatigue, wear it down, and it's just kind of a mass effect, where I'll show you on probably I think the next slide here, actually a full range of different plyometric exercises. And the goal here is really, having a range of muscles, exercise, being able to tailor this to the unique needs of each patient. We have a lot of either bodybuilders, competitive athletes, people that come in looking to improve very specific aspects. And I think, understanding the functional benefit of this has been absolutely key on how this has been super unique.
And I want to say a word technologically here. One is you've got a lot of times when a company comes out with another device, you have to buy a whole nother device. You need the brains, you need everything. Whereas the Sofwave unit runs this. We don't have to buy a second major device with all the, everything there, the power supplies, everything that goes into the main unit. So you don't have the cost of that also. And also, it all talks to each other via wirelessly. These little components you see there, they are talking wirelessly back to their unit, back to the main control unit. So it's really very, very advanced from a technology standpoint as well.
And from a space, because at some point you feel like you're walking a patient into like a used car lot. It's just one device lined up after another, and you're trying to even weasel the patient into the room because you have so many big boxes. So 100%, I love that. And this is really cool because this shows you some of the exercises of how they've actually set that up and what they do. And probably not even doing it justice, but because of the AI technology built into it, rather than just stimulating every muscle exactly, it can control the timing by the milliseconds of each pad and exactly the placement of where you put it and how they fire in sequential order, just like with these exercises would in real life. So, and there's a whole variety. And the idea behind this is they've spent a lot of time studying this, that, just trying to fatigue every muscle and get to the highest intensity possible, wasn't what was causing people to get the best benefit from these treatments. And you can really see it's outlined. It's super easy because it's color coded. So, there's not really a huge learning curve here. You basically follow the color codes, you follow the numbers, super easy to place on. But then the amount of different exercises that you can do for the different body areas is absolutely massive. And this is something that for especially our fitness patients has really resonated with them, because they actually can feel some of this. And it's funny because they'll come in now requesting me like, hey, I really want to work on this. This is a exercise that I struggle with. I need to enhance this. And then they see progress over time. So I think them working on true exercises, building this, and then being able to have people work up to it. And they actually have levels that you can kind of keep increasing people as they're getting stronger to some of these more challenging exercises that are multifaceted, rather than just trying to do an entire bicep in just one stem.
And if you think about it, when you're at a hotel, I saw you in the hotel in San Diego in the fitness center, you've got you've got like 20 techno gym machines or Light Fit, whatever brand they are, and they all do a different muscle group. You have this huge device to do that, and this one little box is programmed to do all of those things in the whole hotel fitness center that we go to.
And this just shows you the just vast amount of exercises that they've integrated into their device. So, it's one of these things that they were just going to keep improving, and they're not stopping. They have some more ideas. The James, who's designed this, he's brilliant, and it was actually it's super enlightening for me to be able to spend a little time with him. And then wanted to show you guys a few results here of what people have changed. Even though we're going to show you some results, one of the things that I wanted to kind of put out there and how we've reframed some of this for patients is really talking about a functional change. And this is why we've integrated it with some of the body compositions, with some of the skin tightening, with some of the weight loss track stuff, because the idea that you're just going to, do a treatment of pure impact and then, become a bodybuilder, isn't realistic. And all of us hang our hat in our reputation. And so, really understanding this from a functional improvement, I think has been a much better pattern for our patients than trying to do something else. And I think, they respect that. I think they understand that. I think it makes a much bigger difference for them so that they really, really understand where they're coming from. And I think that's been super, super helpful for our patients.
And how does this go? Maybe go to the next slide. How does this go with the surgical practice? Let's see what the next one looks like.
And so
there you can see the ghost image of the difference you made. But I saw a patient today who I was done with his body contouring, took the fat out, and it's like, okay, they were asking me about the pure impact. I said, now you can actually work on this and see your muscles, because before you had all this fat over it. Even if you had muscles, you weren't going to see the tone. So it works hand in hand with our body sculpting. And a lot of these people may not go to the gym as much as they want to, or we want them to. But this is a nice kickstart to that appearance of fine muscle tone. Like, look at this here.
No question. And it's something that, we've incorporated and if we actually do it as a bonus. And so that everybody gets a trial when they hit a certain goal in their weight loss journey. One, it's a nice add-on benefit to them. I think they've already started making that fitness jump. So it helps them with that. Some of the things that we've been exploring a little bit is, whether we should be doing stuff like pure impact for some of our mommy makeovers, at a month, because most of the time everybody knows that it takes so long to build your strength up, get back to a good spot. And so, can we decrease that recovery time if we get them stimulated and start doing some of these things, maybe 2 weeks, maybe a month. And so just kind of sharing some of the things that we're playing with in our office is, how can we help people recover faster and get to a better spot much quicker? So TBD, but something that we're playing with. And I may pick your brain this next week, Barry, about some of those things.
Yes, we will. Look at this.
And again, someone who's super fit, right? You're enhancing this. And so our patients that are already on their journey and have picked up some of this fitness, they do absolutely fabulous, right? Because it's just enhancing what they're doing. We've built in some kind of membership subscription type stuff that has been super, super helpful, because it gets people excited and then kind of keeps them moving along and makes it super reasonable for them, but also keeps them coming to the practice every month.
One thing, go back one. I think people have a question like, what, do we do 4 treatments? Do we do 6 treatments? I believe the standard is to do 4 treatments 1 month apart. But I always say to everybody that, that'll get you there. That's the standard treatment. But if you do 2 more, if you do the 6, you're really going to see what's going on. So I think we toy between 4 or 6 treatments. What do you do, Johnny?
We do 4, but we really push everybody to get on a membership subscription type thing, because I tell them, if you just do the set, whether it's 4 or 6, and then just kind of stop and don't go. I mean, you're going to see some improvements, but it's going to fade. The people that are coming in do their initial, come in every month. They're the ones seeing progress. Also, I feel like it helps hold people accountable, because then they're supplementing this with their own workouts. It's helping them get over the hump. So that's where we've seen, kind of the biggest benefit for us.
So as long as they are a member, they can come and get treat. Is there a limit to how many treatments they can get?
So kind of depends which package. For the most part, most people get in their kind of our baseline membership stuff. They come in and they get one treatment a month.
Okay, good.
This is from our friend, Dr. Greg Miller. And so, he does a phenomenal job, but you can also see here, some of the central visceral fat and kind of muscles being enhanced there. And so, something else that I think Barry was talking about is how do you keep improving that area? I think great result, obviously a thin, fit patient. And so just improving. And he does a great job with his OVO videos.
Yeah, we've used the OVO a lot because people don't really get to see their 360 view, which they do in OVO, and it's a really cool imaging system made from the camera they used in the Avatar movie.
And really nice, because photography is one of these things, especially when we're talking about muscle stim and so forth. I think unless you're really, really good with your before and afters or video capturing, can be challenging to show changes.
There it is.
Yeah. And so, this is, then we'll open up to questions, but just to Barry's point, this is how easy it is. So you got your main device, you have your system on the side stuff. So it doesn't take up but a tiny little bit of corner space, and you can kind of integrate all of these. For us, it was interesting because we have 3 offices, and one of the reasons that we loved it when we were adding, a skin tightening e-stim stuff is it was an all-in-one system for us. And, when you're trying to add it from multiple locations, becomes a little bit challenging, and something that we can universally train with. I'll tell you, for me, being having other providers, work in our office, something that lets me sleep at night because, of its safety protocol is immensely beneficial.
And the other, I mean, there's so many cool things that I've said in the design, but like in those little pods, when you return them to the registration there, they're charging. So that's a charging port as well. So when you're using 4, the other 4 can be charging, and then they're charged. And then, again, so well designed with all of that to go with the whole wireless nature of it.
Barry, since we just got a couple minutes and I'm looking at the web chat thing, if anybody has any questions, please feel free to jump in there, but I'm going to pick your brain for a little bit. In the world of
Dr. Franco, just real quick, I just want to let you know, we do have about 10 questions in the Q&A
chat. Please go ahead.
Let's handle those. Let's take those.
And again, real quick, we had hoped that a Sofwave representative would be with us this evening, but she ran into an emergency. So there might be some questions that Dr. DiBernardo and Dr. Franco might not be able to answer, but we'll make sure we get you those answers. But I suspect they're going to be able to answer most of these.
You'd be surprised.
I know. Are you able to see the questions, Dr. Franco?
No, I think that's why we didn't think there were any.
Okay, I can tee them up for you if you guys are okay with that. Ready?
Here, I see them. I found them.
Okay, good deal. Good deal.
Let me start at the top, and we'll kind of roll down and try and hit them as efficiently as we can. Is there a benefit to doing Sofwave every 3 months until you get a desired endpoint, or will you see all the results you will see after 2 treatments with a yearly maintenance?
Okay. Before I answer, where do you see these questions? Is it in the chat?
There's a separate Q&A tab.
Oh, I see. I've got it. Very good. Thank you. Okay. So I'll start with there are protocols, and protocols are made to be broken because every patient is not the same situation. Someone can be older, younger, more elasticity, less collagen. So I think you can start off with like doing a Sofwave, wait a month, do a second one. But what happens after that, I think you need to look at your patient. And if they're younger, they may be good for a while until next year. But if there's some of that tissue paper skin we were seeing there, they're going to need more treatment. So you do have to observe and tailor to what you're looking at and also what the patient's looking for as well.
And I think if they're on their weight loss journey, I think that we're super clear with them. If we're able to hold the line and just not have them have any new skin laxity, over their weight loss, if they're losing 30, 40, 50 pounds, then I think that's a huge win. And that's one of the things, if I could change anything in my personal journey, I would have started my skin laxity treatment soon. So I do think there is a increased benefit. I do think that spacing them out, a little bit to make sure that you make some good progress is helpful, because it does take a little bit of time to see that. So I do think that depending on where they're at, there is some benefit. But we'll keep moving, because I know there's a few more questions here.
The other question is about the original hand piece, and then there's a new one which is slightly smaller, and working that around the eye. You can fit the original one near the eye. You do want to be over the bone there. But I think with the small, there's certain areas that it may just be harder to get into. And the smaller one definitely has its applications, like especially the study we're doing now with the lip lift, getting in there, it's very helpful to use the smaller one. So it's certainly helpful in certain areas.
The next question is about business model. Can you comment on the average ROI from companies that invest in this unit? Also marketing, how do you attract customers? I can't really answer about as a company wide how everybody does. It's probably pretty variable. I'll tell you, we just got our unit in. We actually got 2 units in March, and we've already made enough revenue to pay them both off completely. So I think that's pretty good when you can do enough to pay them off in under a year. So I think it's been great. For us, we've been able to. For us, it's really the way we've marketed this is part of the whole skin laxity treatment for the weight loss patients. We do a lot in terms of talking about some of the Ozempic face and body. I think really educating our staff. One of the things that's been super helpful is we do a once a week kind of morning huddle for everybody. We do a little 10-minute presentation about the different devices and what they actually do, and show some of these before and afters. And I think that's been super helpful. We do a lot on social media talking about these treatments. That's been super helpful. Making sure that if you're doing social media, that you're creating every caption as you would a regular blog, because it used to be that they've come and go. Now your Instagram, your website, your TikTok stuff are all one and the same, so they actually grow over time. So you want to make sure when you make your captions, you create it like a something that's searchable, because it'll grow over time for you.
I'll address the ROI because I've given that lecture 25 years. I have a very simple formula that I tell people to use. And again, we're not going to comment on how the whole country's doing and averaging all the practices. All you need to worry about is your practice. And the formula that I use when there's a new device is, first of all, I guess I'm less worried about how much does it cost, but I'm more worried about, well, what's my monthly payment on it, unless you're going to buy it outright. And then what is the treatment costs that a patient pays? So let me make a very simple example here. Say you're buying all these things and the lease is $3,000 a month, and say your treatment you get $1,500 or $2,000. Let's say $1,500. So that tells me, do I have the ability in my practice or my marketing to get 2 treatments a month to cover this, so I'm not underwater. And then when I get the second 2 treatments, now I'm up 100% in my investment. When I get the next patient, I'm up 200%. So if you cannot say I can't get 1 or 2 patients a month, then you probably have bigger problems than worrying about this machine. But that's how I think about it. If it's a laser hair removal device and the treatments are like only $150, now you have to figure how many of those you're doing. So it's all individual, but I use that similar formula, and I've used it on the last 60 machines. And I make it a point that I'm really pushing these things early, because I always get a lease loan, whatever I'm getting, that I can pay off with no penalty, and just get that off my table. So now I'm all paid up and everything is pure profit going forward, other than paying your staff. That's how I've always done it. And if you pick the wrong machine that patients don't come and pay to go on, you're going to be in trouble. So part of the formula is we identify very good machines. We try to get them early in their cycle, when there's a lot of interest, and then get them paid off right away. That's my formula I've always used.
There's a couple questions just to kind of be efficient about answering some of these, about the number of treatments per the pictures. And maybe the easiest thing is we can actually have, maybe when Kim sends this out, she can maybe check on the number of treatments without going individually, because some are ours, some weren't ours. So I don't really want to speak out of turn.
It was on there. Some were 4, some were 6. Greg's was 4, the others were 6.
But some of those were for pure impact, not for the software.
Oh, yeah. They're probably 1 or 2, but they're not on there. We should put them on. Correct.
And then I saw some other questions here around how many treatments did it take to how many Sofwave sessions for arms, cellulite? When is the retreatment optimal? Is the retreatment a single session? Again, that's really going to be very variable. There's a lot of patients that we do a single treatment. We definitely tell people that they should at least be looking at doing a treatment once a year. Because the majority of our patients are in that weight loss category. As long as they're actively still losing weight, they're going to need more treatments. Unfortunately, our skin doesn't get any tighter as we get older. So, so I think it's super variable, but I guess one key point is it's not like some of the RF microneedling and other things where you have to sell this as a package of 3, 4, 6 treatments. And so that's not necessarily how it's done. There's a lot of patients that do really well with a single treatment.
We only have a couple minutes left, and I see like 3 questions all asking about how much do you charge and all of that. So I think it's different in different areas of the country. In our office, I think if it was a single treatment, it would be $2,000 or $1,995, but most of them get a package of 2, and we do $1,500 per treatment then for Sofwave. How about in Texas, Johnny?
Yeah, I want to say it's I feel like we're about $2,700 for a single treatment, or $2,800, somewhere in that range. For sure. And then same thing with some of the pure impact. And I think somebody said, well, they're going to pay a lot of money and may not see a difference. And that's why I would definitely talk about a functional difference. And, especially as someone who does BBLs and other things, we're super clear, as Barry mentioned on one of the Sofwave treatments, it's not a BBL, it's not a facelift, it's not an arm lift, and I think, being some of that is setting expectations from the very, very beginning. And so, that's why most of our messaging is around functional improvement. I'll tell you, most of the people with pure impact and even some of the other E-stems that we had previously, people that were part of our packages, we bundle this into a lot of our weight loss programs. If somebody signs up for a full weight loss program for a year, they get it at a much discount, but it's an overall global fee that they're with us for a year, and that we're making this overall change, and so that it's a global something, and that's been super effective for us.
And the last question, because we have 1 minute, I'll address the last one on the list, and because that's very important. It's related to does Sofwave cause fat loss? And if you remember the first diagrams we showed on there, where we had the older technology where it was going further down, 4.5 millimeters into the fat. This is an important question because Sofwave is targeted, focused 1.5 millimeters down. That's in mid-dermis. Jason and I have been doing lots of ultrasound measurements of all different areas of the skin with the Clarius ultrasound. And everything you're looking at, most of what you're looking at, it's like in a 2 millimeter thickness. So having said that, it's not in the fat. So you should not see, because it's not aimed at the fat layer as well. So you should be rest assured you're not getting fat loss.
And there's a lot of questions about treatment protocols and other things. They do a phenomenal job training. They have a great clinical team stuff. So they'll make sure that you're set up and on those things. If not, they'll connect you with, Barry's team or one of the KOL experts.
So anyway, this is a Sofwave sponsored MAP meeting webinar. We thank you all for joining. And just to plug it, next week is the MAP meeting in Scottsdale, Arizona at the Fairmont Princess. And we have, I believe, somewhere in the neighborhood of 800 attendees. We have 97 faculty, and I think we have something like 130, 150 exhibitors. Wow. And that's only in our second year. And my goal is to get this to 10,000 attendees. And we're also the educational arm of ASAPS for all of the providers at this level. So in our second year, I think we're really progressing. And anyone who is attending, we will see you next week in Scottsdale. And I'd like to thank our speaker, Johnny, for doing a great job and giving all your prized information to our audience. And we wish you all well. Thank you very much. And hopefully see you all in Scottsdale. Thank you.
Thank you, Dr. DiBernardo. Thank you, Dr. Franco. Thank you, everyone, for joining us tonight.